New estimates from the CDC show that more than half of Massachusetts residents have had COVID. And as WBZ's Nick Giovanni tells us, the infection rate is even higher among kids in the U.S.
The latest data from the CDC suggests a vast majority of kids have now been infected with the coronavirus. Roughly 3 out of every 4 children in the United States.
Kids we know get respiratory viruses all the time. Anyone who's a parent knows that their kid gets colds a lot. And one of the colds they got this season was COVID-19.
Those numbers are based on blood tests from around the country, analyzing antibody levels specifically produced after infection, not vaccination. They show a sharp rise over the past several months in kids who show evidence of past infection.
I think a lot of those cases, of course, were asymptomatic. And, so in a way, of course, it comes as a bit of a surprise to see so many children have antibodies to the virus. And antibodies, to be clear, that would not be generated by vaccination. So these are clearly children who have experienced the virus in some form.
Dr. Richard Malley, senior physician in pediatrics in the Division of Infectious Diseases at Boston Children's Hospital, views these as important estimates based on the sample size. They paint a picture of a virus that's become increasingly difficult to avoid with each emerging variant.
It's fair to say, and it's not a surprise to say, that if you have 75% of the pediatric population demonstrating some evidence of having had this virus, I think over time that number will, get very close to 100%. I don't think that is a risky prediction. I think there's a very good chance that most of us on this planet will experience SARS-CoV-2 infection at some point.
Well, what I'm hopeful is that the kids who grow up in the COVID-19 era are going to generate lifelong immunity to severe consequences from the virus. One of the theories from the start why COVID-19 was more severe in adults rather than children was that we don't have as adaptable an immune system. And so if kids are growing up with this virus and this virus becomes widely endemic, it will maybe never be something more than a cold to them.
Even if kids have developed antibodies from a previous exposure to COVID-19, Dr. Malley and Dr. Sachs at Brigham and Women's point out they can still get infected again. So both stress the importance of vaccination as another layer of protection. Reporting in Boston, Nick Giovanni, WBZ News.